my name is Lene. I'm going to be demonstrating how to reconstitute a med as well as administer that medication through a CIVA pump. Okay, so I'm going to first begin by grabbing my medication from the Pyxis machine. So ideally, we would want to do our first med check at the Pyxis machine, but for this demo, I'm just going to be doing it right at this table here because I have all my supplies with me. Okay, so before I do anything, I'm going to want to wash my hands. Okay, so we're going to do our first med check by comparing the vial with the MAR. Okay? So right drug, penicillin, right dose is 4 million units, and the vial says 5 million units, so we know that's going to have enough that we need. The right route is IV, the right time is 11:30, and the right patient is Pablo Pitts that I'm going to be administering this to. Okay, so I'm going to look at the drug monograph to determine, making sure that's a safe dose, making sure that the reason is correct, and just checking my dosaging, so like how much I'm going to be diluting and reconstituting with. Okay, so the right dose, our right drug is penicillin, so it is an antibiotic, and my patient has a history of COPD and currently has pneumonia. So it's an infection, we want to treat it, and the antibiotic will do that. So our maximum single dose is 5 million units, and he's getting 4 million units, so that's within the safe dose reach, that's good. Okay, so our vial is 5 million units, so we're going to insert 8.2 milliliters of normal saline into this vial to reconstitute it, giving us a final volume of 10 milliliters. Then I'm going to go to the CIVA, so penicillin, and we're doing 4 million units is the dose. So according to that, we want to have 40 milliliters in a 60 milliliter syringe. So after I have the reconstituted drug, I'm going to be inserting 30 milliliters of normal saline into 60 milliliter syringe, giving me a final concentration of 40 milliliters into a 60 milliliter syringe. Okay. So now I'm going to sterilize the vials, so my drug as well as the normal saline, before beginning to withdraw the medication, maintaining that sterile vial. So I'm going to swab for 30 seconds and let dry. For the purposes of this video, we're just going to say that that's 30 seconds. Alright. So now I'm going to grab my 10 milliliter syringe, sterile syringe, and put the needle on the end here. I'm going to then withdraw 8.2 milliliters of normal saline. So I'm going to first draw back 8.2 milliliters of air and insert that air into the syringe. Now I'm going to invert it and withdraw the medication, this normal saline, sorry, and making sure that there's no air bubbles in the vial. Okay, so we have 8.2 and there's no air bubbles. That's good. Okay. Then I'm going to be inserting the normal saline into the penicillin vial. This is when we're reconstituting the drug here. So we're going to allow the negative pressure to pull back on the syringe to ensure that we don't get any medication flying out. Okay. Alright, so I'm going to roll the medication. And then I'm going to withdraw 10 milliliters. That is my final concentration after reconstituting. So we're going to inject 10 milliliters of air into the vial. And we have a rate of 300. And withdraw 10 milliliters. Again, we're going to make sure that there's no air bubbles in the vial. Yesterday, we were like pretty much done with all classes, and it was like the best one she had. And then give me a final volume of 2 milliliters. making sure no air bubbles once again. Okay, so we're just going to recap it. Okay. Then I'm going to withdraw my 30 milliliters of normal saline from a mini bag. That's just because it's such a high concentration, so it's a lot easier than grabbing it from one of these vials. So in a real situation, I would have the pole or whatever close to me and not inside the patient's bedside here. And hanging an IV pole helps make it a lot easier to withdraw the medication. So I'm going to want to make sure that I swab the end of the mini bag. But you figured it out. Yeah, I was like, oh my god. So like that. Take off the med cap, or the needle cap, and we're going to insert 30 milliliters of air, and then withdraw 30 milliliters.
Well, no, I'll do yours first. Go ahead and mix that. And then,
so make sure throughout the procedure I'll be
once again making sure there's no air bubbles.
the other 5 right, so the right reason my patient's doing the job, the right to groups, the medication, the right education, the right evaluation, and the right to
Okay, so we have 30 milliliters of normal saline. So I'm going to recap that.
make sure I get that right dose. So you need that dose of 80 milliliters.
Okay.
So right now I have 100 milliliters.
Okay, so I'm going to
Karen just explain, like,
so now I'm going to do the 2 syringe method and insert the reconstituted drug into the normal saline diluent. Okay. And now we should have a final concentration of 40 milliliters in a 60 milliliter syringe. So we have a 60 milliliter syringe here, and making sure there's no air bubbles. And we have 40 milliliters, so that's good. So I'm just going to cap this to ensure that it stays sterile. Okay, so I'm going to put med label now on the syringe. So I'm just going to refer to my mark here. So we want to make sure that we have the patient's name on there. So Pablo Pitts, so we're going to do initials. So the drug name, which is penicillin G. The dose, okay, so which is our 40, our dose is so our dose is the 4 million units. The volume that we're giving is 40 milliliters, and the date is October 19th, and then my initials. Okay. And so according to the CIVA, for the penicillin, we're going to be administering it on a normal rate. So I'm just going to note that here just so that I remember. Okay. So now I'm going to do my second med check. Okay, so we have right drug is penicillin, right dose, so our 40 milliliters that we're going to be inserting. Right route is IV. Right time is 11:30, and right patient is Pablo Pitts. Okay, so we have the correct dose, we have the correct med. So I'm now going to enter into the patient's room. And remembering that the patient always has the right to refuse the med, so I have to just remember to keep that in mind. Okay. So good morning, Mr. Pitts. My name's Linnea. I'm going to be your student nurse today. I'm just going to be giving you your penicillin, okay? So your penicillin is an antibiotic, so it's going to help with your infections and pneumonia. And there's a few side effects that we just want to watch for, but that aren't anything quite serious. It's nausea and vomiting and diarrhea. Because you've had penicillin before, we know that you haven't had an allergic reaction to that, so yeah, we're okay with that, but we're still going to keep an eye on that, okay? Okay, so we're going to do our safety checks, so making sure it's the right patient. So Pablo Pitts, can you tell me your name and your birthday? Okay. Making sure that the call bell is within the site, that the brakes are on, which they are, and there's nothing around in the room here. Okay, so I'm going to do my third med check. So, right drug, penicillin, right patient, Pablo Pitts, right route, IV, right dose is the 40 milliliters after the reconstitution and dilation, and right time is 11:30. Okay, so now I'm going to prepare for my administering the drug through the CIVA pump.
I'm fine.
Make sure that I keep the ends sterile.
I use steroids, but it's are you having trouble with this yet? It's fine. It's okay.
Okay, so I'm going to begin by priming my line here.
So I have my right patient, right
To
container,
remove these,
my right drug, hydrocortisone, my right dose of 80 milligrams, my right route, intravenous, and the right time, which is 11 a.m. You get this.
so while I'm priming my line, I want to make sure there's no air bubbles within my line.
Before I enter the patient's room, I'm just going to do some hand hygiene.
And I just want to make sure that it's not
Got my microtubing, my
okay, so it's primed.
So make sure that's labeled
Okay,
as well.
so I'm going to make sure that I keep this sterile, and I'm going to be swabbing the port closest to the patient, and that's to, because we want this medication to go in on its own. Okay. So we're going to use this port here, so I'm going to swab it again for 30 seconds.
Okay, so we should be ready
So,
to
for purpose of this video, that we'll consider that 30 seconds. So I'm going to, again, we're just making sure there's no air bubbles, which there's not, so that's good.
Hello, how are you doing today?
And then I'm going to be doing it via CIVA pump. So I'm just going to adjust what this is here.
Okay, perfect. That's right, yeah.
And pull this down.
No? Alright.
So we need to insert this like this.
Okay.
Okay, so we're going to put it onto normal because that's what it said there. So normal.
If you want us to.
Okay.
Primary infusion is compatible.
So that has begun. And then I'm going to be administering, after this is finished, 3 milliliters of normal saline. And that's going to make sure that all the medication is out of the tubing. And I'm going to be infusing that at the same rate as I just infused this medication here. Okay. I'm going to make sure that I label the tubing. So we've got our date, time, and initial on the tubing there. And, okay, so, Mr. Pitts, is there anything else that you might need? No, you're good? Okay. So, I'm going to be coming back later to evaluate and just make sure that you're still feeling all right, making sure the medication is working. We might check the lab work to make sure that their white blood cell count has gone up and everything. And infection is going away. And now I'm going to document. So, for documentation, I'm going to put the time, so 11:30. 30 is when I administered, and my initials. So